In the last 20 minutes, the fourth junior doctor strike has begun, and like the ones before, this 48-hour walkout will only affect routine and non-urgent care. It means that 80 operations and about 740 appointments have been cancelled across Nottinghamshire's main hospitals, but emergency care will not be affected. However, that's not going to be the case next month when an all-out strike is scheduled. If the action goes ahead then, on the 26th of April and the 27th, emergency and intensive care staffing will be withdrawn.
But instead of standing on the picket line today and tomorrow, some junior doctors in Nottinghamshire are running free public sessions, teaching them people like you and me basic life-saving skills. Andrea and Kishan Rees are two of them with you now. Good morning.
Good morning.
So what skills are you teaching people?
So as a group of doctors today, we're spending the day teaching the public the basic skills they need should an adult or a child collapse and what they can do to help.
What kind of things then, Kishan?
It's a range of things really. Things like if somebody was choking, if somebody collapsed. It can be very difficult for members of the public if to be faced with a medical emergency. So it's just, as Andrea said, really giving them the skills to cope with that and start the initial life-saving treatment.
Why are you doing this?
Well, we feel that it's really important that the public know these skills. When a medical emergency happens, it can be an incredibly stressful event for a member of the public to witness. And as a result, sometimes they can freeze. And as doctors, it's a real privilege to be in a position to be able to impart potentially life-saving skills.
Some people might say that the best thing you could do as doctors today would be to go to work.
I think that's a fair comment, and it's interesting that you say that, and I'm glad that you've mentioned it. No junior doctor across the country wants to strike, and it's very much a position that we've been forced into. But we're only doing that because we've got the full backing of our consultant colleagues and a range of allied health professionals who are more than capable of providing cover. So an important message to the public is that if they do have an emergency and they are unwell in any way, they really must attend the emergency departments as they ordinarily would. Some of the scaremongering that I've seen in the media, I've been quite scared
What sort
about.
of scaremongering?
Well, there's the Hunt effect in terms of the health secretary kind of mentioning things, that there's no staff and things that are completely false. And
well, the junior doctors are out on strike, so there won't be any junior doctors there, will there? You'll be out there with either placards or doing this life-saving training.
I think it's not just junior doctors in terms of that are providing emergency care, and I think we need to look at the fact that junior doctors, their main role in hospitals, let's not forget, they're training, they're still learning their skills. So if they're not there, the consultants that would be spending time teaching and training those junior doctors are actually on the front line and making the decisions for emergency patient care.
Isn't it enough now? This is the fourth walkout. The Department of Health says the strike is irresponsible, it's disproportionate. Just looking at Nottinghamshire, 80 operations, 740 appointments. Is it time to stop all this, Andrea?
Well, I think it's interesting. Charlie Cooper wrote in The Independent yesterday that the Patients Association are actually glad to see that the contract imposition is being challenged. And I've actually set up a social media broadcaster, WatMed Media, so I speak to people in the street, in the public, and the vast majority of public support are on junior doctors' side. Of course, there is a minority that are against the strikes, and that is their right, and we listen to their opinions.
Do you think that might change when it's an all-out strike of all care, including emergency care, which is what you're threatening next time?
Quite possibly. I think that could change. And I think as doctors, it's, we still are amongst the most trusted professions in the country and the most trusted professionals. And I think it's important that, like events today, we continue educating the public, we continue letting the public know why this is happening, because I think the overarching issue is one of the NHS being lost. And if the NHS is something that the public value, then they really need to get involved. And potentially the Prime Minister, I appreciate that he's probably got his hands tied up with the Panama Papers at the moment, but really if he stepped in and got involved in negotiations, then maybe the full walkout wouldn't happen.
It could be that he backs Jeremy Hunt and he's fully behind all of this.
Well, he hasn't said anything on the matter yet, so let's see, who knows?
Do you actually, I'm wondering what's actually going on here for you two with your life-saving skills that you're teaching people. I'm wondering, are you actually feeling a bit guilty about this? Are you feeling guilty that you're not going to work today?
I think it's, as we've said, it's a very difficult decision for any doctor to strike. But doctors would not be striking if there was not cover in terms of providing that care.
Do you feel bad, Andrea?
As Kishan has said, none of us would willfully put any member of the public in danger. That's not what we trained for. We would not be going out on strike unless we knew that there would be appropriate cover within the hospital.
Well, thank you very much for coming in to tell us about it today. Two junior doctors from Nottingham, Andrea Warnock and Kishan Rees. It's BBC Radio Nottingham.
Talking of being rude, as Mark was to Sarah a few minutes ago, Jaden Kirkby says, "Re the junior doctors, that woman who interviewed them was attacking them. Very rude. They work hard for barely more than the living wage. I fully back them. The government has been well and aware of their planned action, but by refusing to negotiate, the government has put the public at risk."
That'll be me then.
You're supposed to be the nice one, Sarah.
Am I?
Yeah.
Is that right?
Know your place.
I think if you ask people interesting questions, you tend to get good answers, and I think that's what happened there, but I'll try and be nice
Don't.
when appropriate. Thank you, Jade.